My name is Patrick Vinck. I work at the Harvard Humanitarian Initiative. I make up words that don't exist in English, and I'm holding a pen because I didn't know what to do with my hands. Have you noticed how a lot of the crisis maps don't have a background information? When it comes to health and public health, nobody questions the usefulness of having demographic and health surveys conducted every 5 years. It doesn't exist when we talk about security and crisis. So what we set out to do a few years ago was exactly that, conducting surveys on peace, security, reconstruction in countries affected by conflict. Now, what we realize is, of course, those data are difficult to acquire, they are difficult to organize, and they are difficult to present. What we did in response to that was really develop a series of tools, applications that would help us streamline that process, make it easy to collect the data in a way that would be faster to report, accurate, and easy to access. And so what we did was develop KoBoToolbox. KoBoToolbox is a series of applications, as I mentioned. The first one really deals with building the form. At this point, what we are doing is simply providing an application that helps people organize their questions, export that so that it can be put onto a PDA running Android, and start collecting the data. What we are working on is really building that further so that if you need, for example, an assessment on earthquake and water and sanitation, it will suggest for you a list of questions. And that list of questions will come from database that can be customized and really assist the process not only of collecting the data, but of creating the assessment. The second part, of course, is the data collection itself. I'm not going to spend a lot of time on that. We are building on open source technology, work done by Java Rosa. Open Data Kit has been instrumental in what we are doing. But the key part is that it allows us to collect information in a way that is much better in terms of having quality data. How we aggregate the information, how we synchronize it, you can do it online, you can do it remotely when you don't have connection. We work in places that don't have any kind of connection. You can also simply use types of applications like Dropbox that allow you merging all that information together. For us, the key part in here is that we are putting together a whole series of types of data. With the same tool, we're able to collect voice, written text, images, videos. All of these data are integrated into one place, so we can really talk about doing mixed methods, integrating those different streams of data in the same data collection instrument. Now, the mapping for us is key because we also wanted to move away from our own narratives, writing reports, and let people interact with the information. And what we did was create KoBoMap. KoBoMap is what you see on the screen now. The beauty of it, the simplicity of it, is that it's simply linked to a spreadsheet. It can be a Google spreadsheet, it can be a CSV, whatever you want, and you link it to a Google map, and you can very easily update the indicators, add new indicators, change the information that's there, and you can click and visualize graphs that are related to that information. We also wanted it to be very light so that anyone can visualize it, even if you're in places that have low bandwidth. So we use JSON file for the geographic information, we use text-based to transfer the data itself, and in fact, the only thing that's heavy to transfer is actually the background map from Google. I wanted to spend some time talking about, well, what's next? What are the issues? What are we facing? Well, one of them is, how do we share this information? How do we all speak the same language so that the data that comes in a Ushaidi map, a crisis map, can be overlapped with the information that we provide in our type of surveys? Now, one way of doing that is to have some kind of centralized system. But there are many issues with that. Ethics on how you share data, how you collect, of course, but also a lot of proprietary information. I don't want people to have my data. We see that kind of reaction very often. So we need to find a way so that you have a client-based type of approach. It was great to see what was presented by Pink, because I think it goes into that direction where you don't necessarily have a centralization of information, but you're really just sharing layers and picking up whatever layers you want to see from your client side. Also avoids questions of duplication of information, versioning, where one set of data has been updated, but it's not reflecting in the centralized database. So a lot of questions around that. Another question is, what data? How much data? What do we need? And I know it's a question we all face, and with the automation of analysis, more data is better. Well, it's not always the case. Is there a point where more data hides the information that you're interested in. I know I'm late compared to the slide, so you didn't see the frog behind me. I like frogs, so I just use frogs. But the idea is that with too many data, at one point you can't see the frog itself. Finally, we are working really on adapting these tools, especially for emergency needs assessment, so that the process of the first few hours collecting and knowing what information to collect can be sped up. And that deals with both creating the assessment, how you analyze and synchronize all that data, and collecting it.